All right, team. I've got a challenging case for us today. The patient presents with climbing injuries, mastoiditis, and vaginitis. Let's brainstorm potential diagnoses.
Based on these symptoms, it could be osteomyelitis or possibly even osteosarcoma.
I think it might be a case of Lemierre's syndrome, considering the climbing injuries and infection in the mastoid bone.
What about a rare form of atypical femoral fracture? The climbing injuries could have triggered it.
I'm leaning towards pyogenic arthritis, which could explain the joint pain from the climbing injuries and the infection in the ear.
No. You're all way off track. The correct diagnosis here is ascending cholangitis.
Ascending cholangitis? How does that relate to the symptoms the patient is presenting with?
Trust me, it all fits. And the treatment we need to perform is amputation.
Amputation. That's a drastic measure, Hawks. Are you sure about this?
It's risky, but if Hawks believes it's the way to go, then I trust his judgment.
Let's prepare for the procedure then.
We'll work together to make sure the patient has the best chance of survival.
Damn it. We can't afford to be wrong on this one. Get ready, team. We're going in for the amputation and we're giving this patient a fighting chance. Tracy, I need to perform an amputation on my patient with what I believe is ascending cholangitis.
Hawks, are you sure about this?
Of course I'm sure. I have years of experience in this field.
Hawks, you have a track record of being wrong. We can't take this decision lightly.
Tracy, I know what I'm doing. Trust me on this.
I want to trust you, Hawks, but we need to consider all possibilities before taking such a drastic step.
Fine, I'll run more tests. But mark my words, amputation is the only solution here.
I hope you're right this time, Hawks. Don't let your pride get in the way of making the right decision.
I won't, Tracy. I promise you, this is the best course of action.
Leslie, the patient is in critical condition. We need to act fast.
I know, Frank. But how do we tell Hawks that the amputation was the wrong treatment for ascending cholangitis?
We have to be honest with him. He needs to know the truth.
I understand that, but right now our priority should be the patient. We need to focus on saving his life first.
You're right, Leslie. Let's stabilize the patient, and then we can figure out how to approach Hawks about this.
Agreed. Let's do everything we can for the patient, no matter what Hawks may think.
What were you thinking? You nearly killed our patient with the wrong amputation area and the wrong diagnosis.
But we did our best with the information we had.
I still think it was a case of vascular insufficiency.
No, it was clearly a neuropathic issue.
I agree with Randall. It was all about the nerves.
You're all incompetent fools. It was a classic case of compartment syndrome. How did you miss that?
I'm sorry, Dr. Hawks.
I should have considered compartment syndrome as well.
I guess we dropped the ball on this one.
I can't believe we missed such an obvious diagnosis.
I can't work with a team of buffoons like you. Figure out what went wrong and fix it. I'm out of here. So, how's everything going outside of work, Johnson? Any exciting plans for the weekend?
Oh, same old. Just trying to catch up on some sleep and maybe finally finish that book I started months ago. How about you, Hawks? Any big plans or just burying yourself in another complex case?
Actually, this case has been consuming me, but I think I've finally cracked it. The symptoms were right in front of me all along. It's a rare genetic disorder that presents in a uniquely.
Wait, you're leaving just like that? What about lunch? And saying goodbye, maybe?
Sorry, Johnson. This can't wait. I'll catch up with you later. Thanks for understanding.
No problem, Hawks. Go work your medical magic. Just don't forget about us mere mortals in the cafeteria.
I need everyone's attention. Ascending cholangitis was a misdiagnosis.
Hawks, what are you doing in here without proper protective gear? This is an operating room.
This is completely unacceptable, Hawks. You're putting everyone at risk.
You can't just barge in here like that, Hawks. It's against protocol.
Hawks, please explain yourself. What's going on?
I've reconsidered the case, and after consulting with experts, I believe it's Genetic Alliance UK.
What's the prognosis for Genetic Alliance UK then, Hawks?
We need to know how to proceed with the new diagnosis.
Tell us straight, Hawks. What's the outlook for the patient with Genetic Alliance? Okay?
Tracy, I finally found the right diagnosis for the patient.
Congratulations, Hawks. That's a relief.
If I didn't have such idiotic doctors to work with, we wouldn't have been in this mess in the first place.
What do you mean by that? You're the one who declared the wrong diagnosis.
Well, my diagnostics team should have caught it before I did.
You can't shift the blame like that, Hawks. You made the call.
Sighs, I need some air. Sighs heavier, then storms out of the room.